Hi, my name is Cassidy Leake. This is my Module 5 graded activity for consumer health. Um, so for the first question, it says discuss how you might determine what kind of healthcare facility you would need for a family member who can no longer take care of themselves. So based off the information I found that you have to start by determining where your loved one's at as far as their ability to care for themselves and the development of their memory failure. So just kind of figuring out exactly where they're at, like what exactly it means when they say that they're unable to care for themselves. Does that mean that they're able to do literally nothing, or can they use the restroom on their own, or things like that? So just kind of determining where they're at. So do they need 24-hour watch? Are they wanderers? So things like that. And the sources that I found said that wandering and poor judgment may signal the need for 24-hour supervision. So that's just something to be aware of before you're really narrowing down your search for a facility. What steps would you take to find a healthcare facility for this family member? I would begin by getting a diagnosis to determine exactly what behaviors are going to be exhibited, as well as possible problem areas that might need additional focus. So, as far as just getting a diagnosis, it kind of gives you more of an idea of exactly where they're going to progress to, as far as the debilitating behaviors that they're starting to develop, as well as the memory failure. Is it just dementia, or is it Alzheimer's, things like that? So just getting a diagnosis will give you a better idea of what kind of service they're going to need. Next is to educate yourself and your loved one so the whole family can be a part of the decision in placing a loved one in care facilities. So this transition will be a little bit easier if the whole family is a part of the decision-making process. So if everybody's on board and coming to visit these options of different facilities, it a lot of times makes the family feel a little bit more comfortable as a whole, as well as the patient feel a little bit more comfortable knowing that their family approved of the place, they've been there, they kind of checked it out before they got there, things like that. Next, similar to what I talked about in the first question, but a care assessment to determine your loved one's needs. So the source that I had found gave 5 categories. So personal care, household care, so like their ability to cook and clean, do laundry, things like that. Healthcare, so medication management, are they able to take their own medication? Do they need somebody to give it to them so they know when to take it? Things like that. Emotional care, so do they need conversation, companionship, or are they pretty much good alone? That doesn't affect them too much. And then supervision, so overnight stays for some cases, 24-hour watch depending on circumstances, and just preventing wandering. The next step that they have is speaking with healthcare professionals, such as their doctor, about your concerns, as well as the geriatric care managers and licensed clinical social workers, who actually their job is to do that, help you find services. And they can also be a great resource for guiding you in the best healthcare facility for your loved ones. This is another thing that I found on one of the sources. It said to take into account the financial status of the loved one. So, do they have benefits that are going to cover this care for them, or are they going to have to take it out of their retirement? So just kind of taking that into account before you're narrowing down your options too much. Who else would you want to include in this decision making? I think that the family is super important to include. Like I talked about in my earlier question, just make the transition easier for everybody. And speaking from personal experience, I know it's super hard to drop off a loved one at a facility like that that you know little about, especially because there's a lot of feelings of guilt and wanting to be able to take care of them on your own, things like that. So by bringing the family in to let them be a part of it, it makes the process a little easier for everybody. How would you verify if the healthcare facility is safe? So this is just kind of common sense. I thought as far as just doing your research, talking to people who have stayed there or had family members there, do research online, read reviews, and things like Yelp can be a good resource, possibly consulting with a professional. And then what key elements would you require? Caring staff would be important to me. Medical professionals, not simply people who claim to be caretakers. And then that the facility has experience working with like diseases that my loved one has. Okay, that's it.